What better way to end our musical journey than by synthesizing all our knowledge about antiarrhythmic theory and appreciation at a dance party? Certain agents used for the treatment of arrhythmias do not fit the conventional class 1 through 4 organization. These include digoxin, adenosine, magnesium, and potassium. Hey, you recognize that deep house sound, right? It's DJ Foxglove. I guess he lays down the real techno in between his smaller gigs at local high schools. Remember that digoxin is one of those drugs with positive inotropic effects used in heart failure. Well, it's not just heart failure that inspires DJ Foxglove to drop a sick beat. Remember that rhythm-inducing record he was spinning at the high school dance? It's our recurring theme for agents that can be used as antiarrhythmics, foreshadowing the epic dance party that's about to unfold tonight. Now, this isn't your grandma's high school dance. Well, because it's not 1935, but also because this is Vegas, baby. Recall that digoxin exerts parasympathomimetic effects via direct stimulation of the vagus nerve, as highlighted by our fabulous Vegas welcome sign. And because cholinergic innervation is much richer in the atria, these actions affect the atria and AV node conduction most. Does this sound like any of the other antiarrhythmics we've already encountered? That's right, the beta blockers and calcium channel blockers with their ability to suppress AV nodal activity. As you might have guessed, because of this depressant effect on atrioventricular conduction, digoxin can be used to treat similar arrhythmias as those treated with beta blockers and calcium channel blockers, specifically atrial arrhythmias, including AFib. Let's bring back our recurring sketchy symbol for AFib, an irregularly irregular static signal on a television screen, this time incorporated into this cool retro stack of TVs. Recall from the Class 3 Amigos antiarrhythmics video that those agents were useful for treating AFib as well. In that scene, we illustrated someone pointing a remote at the irregular static screen, depicting conversion to a normal sinus rhythm. However, the first goal of treatment of AFib is not rhythm control, but control of ventricular rate, which can be accomplished by digoxin, though it's not first line. When too many signals from the fibrillating atria are sent to the ventricles, this can lead to tachycardia, called a rapid ventricular response. By increasing the AV node refractory period, digoxin can slow ventricular response rates in atrial flutter and fibrillation. This is called rate control, and our recurring symbol, of course, is a rate-controlling metronome, this time a ridiculously huge stage prop at the discotheque. Alright, let's head out to the dance floor and meet some funky ions getting their rhythm on. First up, this guy performing the perfect moonwalk. Have you ever seen Michael J? Wait a minute. What? I see what's going on here. Let these hidden magnets remind you of magnesium and its antiarrhythmic properties. And it looks like he's been doing the magnesium moonwalk back and forth across the dance floor all night long, because those twisted streamers on the ground have been torn to bits by his smooth criminal moves. Remember that the twisted streamer with that squiggly torsades rhythm design is our recurring symbol for torsade de pointe, this time all torn up on the dance floor to indicate that magnesium therapy can treat torsades, even if serum magnesium levels are normal. The mechanism of this antiarrhythmic effect is not completely understood, but it's known that magnesium can affect many ion channels and transporters, including sodium channels, potassium channels, and the sodium-potassium ATPase. Just forget that guy. Poser. I'm looking for something real, like John Travolta real. This is what I'm talking about. Let these two banana-clad disco dancers represent hyperkalemia, with that disco finger up in the air, and hypokalemia, with the finger pointed at the dance floor. Both these conditions can precipitate arrhythmia. Besides arrhythmia, the hyperkalemic patient may present with cardiac conduction abnormalities, ascending weakness, and paralysis. But there are also clues on the ECG. Check out this streamer coming down on this dancer with a peculiar resemblance to an ECG tracing. One of the many ECG changes seen in hyperkalemia is tall, peaked T waves with a shortened QT interval. And notice that where that disco finger is shooting sky high, It also pokes up that T wave into a tall peak. And what about patients with hypokalemia? Along with arrhythmias, they can present with severe muscle weakness, renal abnormalities, and glucose intolerance. But there may be clues on the ECG here as well. So check out the ECG trace depicted by the streamer that has fallen down in front of the other dancer. Some ECG changes seen in hypokalemia include decrease in the amplitude of T waves and the appearance of a U wave at the end of the T wave. Where her finger points down low, she pokes in between the T wave and U wave, emphasizing the two bumps after the QRS. Alright, let's head to the center of the dance floor where I'll introduce the last antiarrhythmic of the night, adenosine. Now, this elevated stage is for experts only, sultans of swing, if you will, and you really should. Let the name swing dancing remind you of the drug adenosine. Also, notice that the shape of the gate leading up to the dance floor has that classic nucleoside shape. Well, adenosine is a nucleoside that occurs naturally throughout the body. Its cardiac action occurs when it interacts with A1 receptors on the surface of cardiac cells. Hence the requirement for A1 level training written on the gate that sections off the dancers. Activation of A1 receptors increases potassium conduction and suppresses calcium current. This means that more potassium can move out of the cell, like this potassium-enriched banana flying out of the cup. And less calcium is able to rush into the cell, like this suppressed calcium ice cream scoop fallen onto the floor. Yeah, it looks like they tried to execute the most technically challenging move in all of swing dancing, the banana split. So close. Remember, it's all in the wrist. Anyways, these changes cause the membrane potential to remain negative for a longer period, and calcium-dependent action potentials are suppressed. Wait, calcium-dependent action potentials. Let's see. Oh, that's at the cardiac nodes. Notice this elevated dance floor is in the shape of a large musical note, the recurring sketchy symbol for the SA and AV nodes. Notice too that we've placed this note at the center of the heart-shaped dance floor, right where the AV node would be. This is because adenosine exerts most of its effects at the AV node, directly inhibiting AV nodal conduction and increasing the AV nodal refractory period. In fact, AV conduction may be dramatically inhibited by adenosine, resulting in high-grade AV block. And here we see our swing dancer placing his shield-shaped hat over his heart. This heart shield is our recurring sketchy symbol for heart block. However, this high-grade heart block is very short-lived as the half-life of adenosine is only 10 seconds. Will represent the dramatic suppression of atrioventricular conduction by once again bringing back that heart-shaped light. Notice that the flying splits kick has caused complete separation of the ventricles from the atria. However, the top of the heart is still lit up, indicating adenosine's role in treating supraventricular arrhythmias. In fact, adenosine is the number one choice for prompt conversion of paroxysmal supraventricular tachycardia back to normal sinus rhythm, as represented by this number 1 dancer ribbon given out to the winners of tonight's dance-off. Adenosine is also a vasodilator that can increase coronary blood flow. We'll signify this coronary dilation by placing this oversized floppy red coronary crown on the head of our victor. This is actually mediated through binding to A2 receptors and is useful in cardiac stress testing to measure coronary flow in patients with coronary artery disease. And with major cardiovascular effects comes major side effects. As portrayed by this dancer here who just couldn't compete, adenosine can cause major flushing as well as shortness of breath and chest pain and even a sense of impending doom. The other adenosine side effects are shown by his equally defeated partner fainting on his shoulder, including headache and hypotension. Adenosine is less effective in the presence of theophylline or caffeine because they act as adenosine receptor blockers. These drugs are known as methylxanthines, and we'll learn more about their uses in the Sketchy Farm asthma video. For now, just focus on this kid leaning up against that A1 adenosine receptor gate, drinking that xanthine energy drink. No swing dancing for him. All right, that about wraps it up. It's time to sum up this sketch. DJ Foxglove is setting up some delicious jams to remind us that beyond its positive inotropic effects, useful in the treatment of heart failure, digoxin also has antiarrhythmic properties. And if you can't tell, we're in fabulous Las Vegas, a glaring reminder of digoxin's ability to directly stimulate the vagus nerve, which increases parasympathetic input to the SA and AV node. Decreased atrioventricular conduction time makes digoxin particularly useful for treating atrial arrhythmias such as AFib, as shown by the irregularly irregular signal on those screens. Also, that ridiculously huge metronome, that's our symbol for rate control. In other words, agents that affect conduction at the AV node, such as digoxin, are useful for controlling the tachycardia associated with AFib, but they are not used to convert AFib back to normal rhythm. Next up was that magnesium magnet moonwalker, tearing it up on the dance floor, tearing up our twisted torsade streamers, that is, symbolizing the use of magnesium to treat torsade de pointe. We then witnessed a head-to-head dance-off between hyper and hypokalemia. Remember, to prevent arrhythmias, normalize that potassium level. Besides arrhythmia, hyperkalemia can cause peaked T waves on the ECG, while hypokalemia adds on that extra U wave after the T wave. The grand finale was the adenosine swing dancers, a purine nucleoside that binds to A1 receptors in the heart, working to increase potassium current and decrease calcium current. Particularly at the AV node, it keeps it hyperpolarized, which is why our swing dancers have decided to occupy the AV note dance floor. This AV nodal blocking agent is first line for those supraventricular arrhythmias, as indicated by the brightly illuminated atria of that heart light. But careful, dramatic inhibition of AV node conduction can lead to high-grade heart block, just like our swing dancer blocking his heart with his hat. And lastly, remember adenosine is less effective in the presence of caffeine, theophylline, and other methylxanthines, which block the adenosine receptor, just like this too cool for school energy drink guzzler leaning up against and obstructing that gate for the swing dancers. All right, party's over. That concludes our tour of the antiarrhythmics. You know, we've been keeping that blood pumping this whole unit, but let's shift our focus to the blood itself.